Today we have special guest Dr. Weisstein, orthopedic surgeon. Thank you so much for making time out of your busy schedule to visit with us today.
Thank you for having me.
Yes, of course. So I understand you specialize in orthopedic surgery and mostly hip and knee replacements.
That's correct.
Tell us about that.
Yeah, so I'm a fellowship-trained orthopedic surgeon who spent almost an extra 2 years training on preservation of hip and knee joints, as well as replacement of hip and knee joints. I recently located to South Florida about a year ago, and I was directing one of the largest hip and knee replacement programs in California prior to that.
Is that in San Diego?
I was actually in an area called Rancho Mirage, Palm Desert, Palm
Very
Springs.
Nice. Very nice, very nice. So welcome to South Florida. Welcome to the show.
Thank you.
And I'm so happy to have you here because myself, personally, I suffer from shoulder injury. So it doesn't have anything to do with knee or hip replacement, but orthopedic surgery is very interesting to me. I wanted to ask you, I saw a little bit about pediatric orthopedics.
Sure.
Is that something that you specialize in now, or is that something that you've had in the past?
Right. So I actually am part of a world-renowned institute called the Paley Institute, and we're based out of West Palm Beach.
Right.
And we specialize in taking care of adults as well as children.
Okay.
But we do see a lot of children because we're at the only children's hospital in Palm Beach County, which is at St. Mary's Medical Center. And a lot of our children have congenital, meaning they were born with congenital joint problems and limb problems. So you might say they have, challenging orthopedic problems related usually to their legs, knees, hips.
Do you have any specific case that maybe you can tell us about, what it entailed, what you saw with the patient, and how you helped them?
Sure. I mean, if one of the great examples that I've seen since I've been here is related to a 14-year-old from the islands. We see a lot of islanders here in Palm Beach County.
Okay.
Especially from Bahamas and Haiti. And there was a 14-year-old girl who was in a car accident who broke both of her legs at the age of 8.
Oh my
and
goodness.
she really hasn't walked since then because her fractures led to early onset of arthritis in both of her hips. And so she sought treatment in her own island in the Bahamas, and nobody was willing to treat her. So she actually came to the Paley Institute, where I work, and ended up doing what we call takedowns of her fractures because her hips were basically fused. And we took down both sides, replaced both of her hips, and now she's a happy high schooler, no pain, walking, and it's one of those special stories.
That is really amazing. Would you say that happens in the islands more so because of a genetic?
Well, I think in the islands, I might be wrong, but I think motor vehicle trauma is probably a lot. Maybe we're in South Florida. I should probably take that back.
Right.
But
No,
motor vehicle trauma is pretty common in developing islands, developing countries.
Absolutely. I've seen a lot of it in South America. I've
Yeah.
gone a lot of times, and it's unfortunate. But we are lucky to have you here helping the quality of lives for children as well as adults. The Paley Institute. Now, if people want to learn more about the Paley Institute, you can visit their website at www.paleyinstitute.org. Tell me more about them and what makes them so world-renowned.
Yeah, so at the Paley Institute, we take care of the simplest to the ultra most complicated cases that a lot of surgeons either have no experience with or really feel very uncomfortable caring for. So we see things that the average orthopedic surgeon often will see maybe once or maybe never during their entire career. That's commonplace to us. So for example, there are patients from the Middle East, from Poland, from Russia, from South America who come directly to the clinic for very specialized care.
Right.
Now, I should say that we don't just take care of very complicated things. We actually have the biggest concentration of pediatric orthopedics in Palm Beach County. But at the same time, we're growing in all directions, taking care of bread and butter orthopedics like simple, straightforward hip and knee
Right.
problems and simple sport-related injuries, things like that.
Okay. So when it comes to hip fractures, what types of fractures are there? How many? What do you see the most commonly? Tell me more about that.
Obviously, in South Florida, with our senior population, we see a lot of hip fractures.
Right.
Very common, especially in the emergency room environment.
Right.
You know, the different types of fractures really are based on where they occur. Some fractures are taken care of by plates and screws or nails, and other fractures really are taken care of by replacement. And the big difference is whether or not the surgeon feels that the bone is going to heal.
I see.
There's been a big move towards total hip replacement
Right.
for fractures, especially in younger active people, whereas in the old days, total hip replacement wasn't so popular because people really didn't know that it would be an acceptable form of treatment for our young active patients that had hip fractures.
So, as far as hip replacements with younger folks, what would bring that on? Is it sports, and what types of injuries are you dealing with?
Right. So, I mean, obviously, we have fractures that can go on to develop arthritis. Very common fractures of the pelvis. And around the socket of the hip. There's another condition called avascular necrosis, where the blood supply to the hip dies off. That's another very common way people end up with arthritis who are younger. We see early onset arthritis in extremely active patients.
Okay.
We also see it in patients who have congenital hip dysplasia. So young people who are born with hips that may not necessarily have a normal ball and socket.
I see.
So we call that hip dysplasia.
Wow.
We see a lot of that up at the Paley Institute.
Now, what does that entail when you're doing a hip replacement? Now, I saw things online about 3D printing, and I wanted to know a little bit more about that. I wasn't sure if it's something that you do.
Right, so 3D printing is a huge technology in orthopedics. It's one of the newest technologies where people are using printers to make artificial bones and artificial joints. For joint replacement, 3D printing isn't necessarily being used widespread at this point, but the essence of a joint replacement, as you asked, is really replacing a ball and resurfacing the socket. So there's a lot of ways to do it, but at the end of the day, there's a new ball, and the socket is resurfaced usually with plastic or metal.
Oh, interesting. What's to be expected post-op when somebody undergoes such a large surgery?
So yeah, I mean, in the old days, people thought of hip replacement as a large surgery, like you're saying.
Yeah.
But I mean, in reality,
It's a big deal.
okay, it is a big deal operation, and we consider it major surgery. But with appropriate mechanisms in place, like a really good anesthesia team,
Yes.
a really good nursing staff, a really good surgeon, a really good operating room, hip replacement has essentially evolved, at least in my practice, to a procedure that lets patients either go home the next day or maybe 2 days after. But
That is incredible.
Yeah, pretty.
I would have never thought 1 or 2 days recovery.
Yeah, so I mean, it's actually very common 1 or 2 days in the hospital, and even for the right patients, outpatient, literally surgery in the morning, out by the evening.
That is incredible.
Yeah.
Where exactly do you perform your surgeries?
So currently I'm at St. Mary's Medical Center and
Where is that?
West Palm Beach and Good Samaritan Medical Center, but I will be getting on staff in Boca Raton and doing cases out of West Boca Medical Center.
That is amazing. So you're new to South Florida. you're working with the Paley Institute, which is world renowned. It's the #1 institute. If you have an issue with your hips or your knees, that's where you want to go. And
think so.
And you're starting your practice here locally in Boca, right? When's
Right.
your first day there?
So probably the first week of July, I'll be working here in.
That's great.
Yeah.
We're happy to have you here.
Thank you very much.
Yeah. So that's you speak English and Spanish, right?
Yes, I actually majored in college in Spanish.
That is incredible. Where? Obviously, you're going to use it a lot here in South Florida. But do you practice it often? Are you fluent? Can you read and write?
Yes, I can read and write. Getting into medical school, when I was applying to medical school, was challenging. Now it's off the charts. Like, I'd hate to be somebody applying to medical school now, but still you try to differentiate yourself, right? So
Right.
I took Spanish. I thought it would make me look different. I also grew up in California, so a lot of people speaking
That way.
Spanish in California, and I knew
Right.
that as a physician, I'd be taking care of these patients. So I
Right.
actually have fairly good followings of patients who feel very comfortable speaking
That is
their native
amazing.
language to a doctor. We have so many South Americans here, and
Oh, yes.
people from Puerto Rico, and okay. Actually, and my wife is Brazilian, so
Wonderful.
we
Okay.
speak at home.
So you're learning Portuguese as well.
I am learning Portuguese. Yes.
The Portuguese and the Spanish, it's very similar, but sometimes there are words that are just totally different. So you
Absolutely.
think you were going to know that, but no, that's me all day.
That's right.
So we talked about the hip, wanted to talk about the knee. How does that work? What is the majority, the bulk of the age group in patients that you see that need knee replacements?
I mean, so the majority cluster, between 50 and 75.
Okay.
Obviously, arthritis is the #1 diagnosis that leads patients to have hip or knee replacements, and obviously, every decade, arthritis becomes more common.
What can we do to avoid it?
Yeah, it's a great question. I have that question
Please tell me, I
every
need
day.
to know.
Right. So there is no magic pill. Okay.
Okay.
There is no magic injection.
Okay.
But I think, I divide it up into thirds. I think 1/3 of it is probably genetic.
Okay.
Okay. So if your mother or father had it, you may be a little bit more predisposed to having it.
Mm-hmm.
I think 1/3 of it is lifestyle.
Okay.
So we know that exercise is good for bones and joints, keeping the muscles strong, helps offload the forces to the joints.
Right.
I think staying an ideal body weight is obviously preferable. We
Of
know that
course.
obesity or being overweight can lead to early arthritis. And then I think 1/3 of it we really don't understand completely. There are factors that are still being studied. People hear a lot, especially in South Florida, about stem cells and fancy
Yes.
injections.
Tell me about stem cells. It's new, isn't it? Too new.
I would say it's fairly new, but at the end of the day, I think as physicians, we need to be evidence-based.
Yes.
And I think what that really means is we need to rely on the literature that's been published. And as far as stem cells go and a lot of these newer injections, we really don't have the data that would convince us that this is an optimal treatment.
Right.
I think it's very experimental, but I think to tell patients that there's an injection that's going to cure arthritis is really unethical.
Okay, yes. Would you say, because for me, I find, because I do suffer from arthritis, I suffer from it in my cervical spine as well as my knees and my shoulder, like I mentioned before. Is there any type of supplements that I can take or foods that I can consume that will help me feel better?
Yeah, so, this is a huge and vast field. There are things out there, none of which are smoking guns. I'll mention a few. Omega fatty acids.
Okay.
Taking your omegas, it's thought to be anti-inflammatory, not 100% proven.
Right.
Glucosamine and chondroitin, which are a billion-dollar industry.
Supplements.
These are cartilage supplements, essentially.
Right.
Really well documented results in the veterinarian literature, but not so much in the human
Interesting. I
literature.
did not know that.
So a lot of people buy that. If you go to Costco, you see Kirkland, glucosamine and chondroitin.
There's a whole section for just supplements.
Right.
And glucosamine's one of the most popular ones amongst my friends who
Right.
work out all the time at the gym.
Yeah.
I see them every now and again.
Right. So I at the end of the day, I don't know if they actually help. There's no smoking gun data.
Right.
But some people really do swear by them. So I think if, they probably aren't harmful, certainly fatty acids are probably good for you.
Mm-hmm. What about foods? How can I get that in through foods? Because me personally, I'm not one to take a lot of medication or even supplements, something that's, man-made.
Yeah.
What can I eat as far as food that will help me?
Well, I think, the answer to that question probably is, eating a healthy, balanced diet without sounding overly generic. I mean, a healthy, balanced diet. I mean, there is no food that prevents arthritis necessarily. I think, drinking alcohol and, high-fat diets.
All in moderation?
All are probably okay in moderation. I mean, at the end of the day, I think it's all about just having a balanced, healthy diet and trying to keep toxins like alcohol and high-fat diets away from.
I've noticed, and being guilty of this myself, we always wait. We always wait for something to happen to get to the doctor's office.
Right.
When should we, obviously if we're paying attention, when should we say, it's time to go see Dr. Weisstein at Paley? I'm not feeling very right in my knee or in my hip. When do we say it's time to go to the doctor?
I think it's a great question. Without being evasive, I can't say that there's a perfect time, but certainly I think if you're having aches and pains, I don't think you need to rush to the doctor.
Okay.
If they've been going on for months, you've tried some anti-inflammatory, something like Tylenol or Advil or Aleve.
Okay.
You've given it the tincture of time, so to speak, and it's not getting better, then I think it's worth seeing your physician. But
Right.
I don't think, if you wake up Saturday and your knee's hurting, you need to make an appointment to be seen on Monday or Tuesday.
No.
I think that's probably the better things to do in South Florida.
So
than,
consistent
Yeah.
symptoms would ultimately, you got to pay attention and say, hey, time to go see Dr. Weisstein.
Yeah.
Yeah. Okay. Well, I know that you've been practicing for quite a while now. It's been how long?
About 12 years.
12 years. And I also saw that you were at Mount Sinai for a little while, right?
Medical school.
Yeah. So my mom works at the hospital. It used to be NYU.
Right.
Yeah. So how was that experience? Was it good for you?
Yeah, what's there not to like about living in New York as a single person, right?
Agreed.
I mean, it's
I'm from New York.
very exciting. Yeah, I mean, it gave me an excuse to walk Central Park every day, and Mount Sinai is on Madison Avenue up in the hundreds.
Right.
It was a fantastic experience. I mean, I think there's something to be said for that hospital in particular. The
I
classmates,
hear great things about it.
great training, great,
Yeah.
just it was phenomenal.
That's great to hear. That's great to hear. So I wanted to ask you a little bit about robotic surgery.
Sure.
What does that mean? What's robotic surgery? People think robots and they think the Terminator.
Yeah, right. That's a great. No, exactly. I actually call that the Star Wars era. That people have, especially the senior population, has this fascination with, like the Star Wars generation,
Right.
And they think somehow that,
Hey, I'm not a senior.
C3PO or R2D2 is doing the operation, but it's not really like that.
What is it like then? Explain it to us so that we can understand.
Yeah, so, I mean, robotic surgery as it relates to orthopedics is really surgeon-controlled, but a robot is being fed the information and acting as a check on what you're doing.
Okay.
So things, for example, partial knee replacements can be done with a robot. Some people believe that the robot prevents outliers. So,
What does that mean?
outliers meaning cases that really you look at the post-operative x-ray and you're like, was that really done by a surgeon?
Oh.
Kind of terrible looking outliers, things that really wouldn't be considered within the standard of care.
Uh-huh.
So, I think a robot in orthopedics acts as a check rein. It leads to more reproducible results, especially for surgeons who don't have lots of experience.
Okay.
But
Which is not your case.
Which is not my case. And again, I've used robots, and I think the word is not out. Total knee replacements can be done now in 2017 with a robot.
What is the benefit of doing the robotic surgery? Why should we look at this, and why should it be out there in the world that this is an option?
Well, I think it is certainly an option, but I would say that if you don't have a robot, I don't think the supposition should be that you're having an inferior surgery.
Absolutely not.
The robot is a way to augment your technique to create more consistent, reproducible results every time. It also utilizes and leverages technology so that your orthopedic surgery can be done in a very precise fashion. But I think the overarching principle here is if you don't have a robot, you're not losing out on anything major, because there are certainly orthopedic surgeons who do a fantastic job with and without robots.
How many surgeries with hip and knee replacements would you say on average you do per year?
Right. So since I just relocated to South Florida, I'm probably in the a couple hundreds. But when I was
pretty high numbers there for surgeries.
When I was in California, we were doing upwards of 500 per year.
That is amazing.
But I directed a program that was one of the largest in the States, where we did thousands a year as a hospital.
So you've got your reps in.
I've got my reps
Muscle
in.
memory.
Yeah, a lot of muscle memory. Yeah,
That's
but I had
great.
a great team, and I think again, it's not just the surgeon; it's also the team that you have, the nurses and the hospital and the anesthesiologists really make a difference.
And I'm sure you have that support that you need not only at your office but also at the hospitals you work out of, St. Mary's, Good Samaritan.
I do.
Yeah, that's great. That's great to know. So any orthopedic issues, go to the Paley Institute. It's where everybody from around the world goes to. I know that if I have a need, I'm definitely going there. Wanted to talk a little bit about conservative management. We've covered the surgery.
Sure.
Prior to the surgery, before we get to that point, I noticed on your website you had something about conservative management of hip and knee arthritis.
Right. So, conservative management is, what we really are calling in the field now joint preservation or cartilage preservation.
Okay.
And what that really focuses on is activity modifications, lifestyle modifications. If you're overweight or you don't exercise, getting to the gym or getting with a trainer or going to a physical therapist, taking anti-inflammatories.
Yes.
Maybe using a brace, maybe taking some of those supplements that you talked about, things that basically don't involve going under the knife. And in fact, there are injections like cortisone injections and artificial joint fluids that are manufactured that can be helpful.
I've actually had a couple of cortisone injections. Unfortunately, I was in a pretty bad car accident in January.
Yeah.
I had some damage in my neck, my cervical, and as well as my shoulder. And I did have some cortisone. And at first, I didn't think it helped. But now that I'm 2 months in, I'm like, oh my God, I feel great. I can do this. I can't do everything that I used to be able to do. Inevitably, I do need surgery. But it is really helpful, and it does buy you some time.
Absolutely, and buying time is really important. I see, as many doctors do down here, patients who, they're living in their golden years, and they've got cruises to go to and bar and bat mitzvahs to go and weddings to be at, and they want to buy some time. They don't want to spend 3 months recovering from a hip or knee replacement.
No, and you mentioned before it's only about a day or two downtime, which is pretty incredible. I had no idea that it would only be 1 or 2 days. You know, people
Yeah.
think, oh wow, my whole hip is being replaced or my knees are being replaced, and they're thinking, oh, I won't be able to go to work for 3 months at least.
Well, you know, the kind of the mantra now is a wellness approach.
Right.
And when we look at patients who have hip and knee replacements as healthy people who, you know, maybe they have a flat tire, but the car is functioning really well.
Yeah.
They need a tune-up and on their way. You
Yeah.
know, in the old days, these patients were looked at as like hospitalized, sick patients.
Right.
But everything is really turned towards a wellness approach.
Yeah, that's pretty amazing. I think that probably the majority of the population would think it would take a long time to recover from something like that.
It probably takes longer to recover from knee replacements than hip replacements, for sure. Something
is
about
that?
the knee. I think the knee is just a different kind of joint. They're, you know, it's skin and bones, whereas the hip has got a lot of muscles around it. It's a deeper joint.
Right.
Patients typically after knee replacement moan and groan longer than patients do after a hip replacement.
Now, and also, you know, a lot of people think, oh, it's a total hip replacement. No, there's partial, right?
Yeah, so there are partial for under the right indications. There are partial knee replacements under the right indications, and you know, essentially, it comes down to what your X-ray looks like and what the expertise of your physician is. Some
Right.
physicians don't like doing partial knee replacements,
Why not?
for example. Well, historically, partial knee replacements, according to registry data, you know, from countries like Australia, for example, haven't had the track record of total knee replacements. But that's very controversial because a lot of it does come down to surgeon experience. Typically, surgeons are a lot better at doing operations that are most familiar to them, and that's total knee replacements.
Right.
So an operation like partial knee replacement, which is much less common, probably doesn't have the same type of expertise being thrown at it.
That's great information to have. So, just, you know, wanted to mention again the website to see the information that we're speaking about today is the PaleyInstitute.org. That's O-R-G. And I believe this one is in West Palm Beach off 45th Street.
It is. We're right on St. Mary's Medical Center campus.
That's great. And then your private practice is going to be locally here in Boca.
Correct.
Whereabouts exactly?
So it will be on essentially Palmetto and between Jog and Southwest 18.
That's great. That's great. Well, I do want to thank you, Dr. Jason Weisstein, for taking the time to come and see with us and educate our audience on what it takes, you know, to watch out for your knees and your hips. Yeah, thank you so much.
Thank you very much for having me.
Thank you so much for joining us tonight on You and Your Doctor. We'll see you next week on Tuesday. You can listen to us on 95.3. Watch us on All County Healthcare Inc. on Facebook Live. Melissa Santiago signing out. Take care.